Good morning, everyone, and welcome to the Fred Hollows Foundation session at the Cake and Pie Expo 2.0. My name is Laura. I'm the Chief Representative of the Fred Hollows Foundation for Hong Kong and ASEAN, and it is my pleasure to open this morning's session entitled The Fred Hollows Foundation Eye Care Model in Vietnam. How training, infrastructure, equipment, awareness, and stakeholder interaction works locally and now globally. Now, the Fred Hollows Foundation is an international eye health development organization that works in 25 countries worldwide to eliminate avoidable blindness. And we build upon the work and efforts of the late Professor Fred Hollows, an ophthalmologist from Australia, who worked hard to bring affordable and quality eye health care to marginalized communities across Australia, across Africa, and across Asia. And we celebrate this year 30 years of sight-saving work across the world. And I'm very pleased to announce that the foundation has restored sight to more than 3 million people worldwide. And since our founding in 1992, we have been privileged to work in and have a special place in our hearts for the country of Vietnam. And we are about to show a short video that highlights and gives an overview of our work in the country. And please join me in welcoming our speakers after this video. Thank you.
Mắt của tôi nó yếu thì từ vài năm nay rồi, nó nhìn xa khó nhìn, nó không rõ mặt mọi người.
The biggest cause of blindness in Vietnam is cataract, about 74% of the cause of blindness. The cataract is the condition when the normal clear lens becomes clouds, and then it can prevent the light into the eye. The patient cannot see anything or they can have blurred vision. In 1992, in Vietnam, there were only 2 surgeons can do the cataract surgery. Professor Hollow came to support the people. The foundation not bring the foreign surgeon into Vietnam, but train the Vietnamese surgeon so that they can do cataract surgery in their country. Now, they have about 1,000 cataract surgeons and they perform 250,000 cases every year.
Teach the teachers first, and then the teachers can teach others.
My name is Trần Minh Hà. I am an ophthalmologist and I am the medical director of Alina Eye Hospital. In 2015, I was sponsored by the Fred Hollows Foundation to visit India. I met with one expert from the WHO. They told me about the affordable eye care model. I was so convinced that this is what will help Vietnam. Alina Vision's approach is quite different from the classic eye care model. We follow the affordable eye care model that we learned from India. Some patients can get the treatment totally for free, some at a subsidized price, and some pay the full price to ensure that any patient that walked into the hospital can choose the price that fit them the most. There is not much awareness of cataract in the community. A lot of people think that it is not treatable and they just have to live with it.
Tôi có các con, các cháu, bạn bè nhiều lắm mà nhiều người mắt lắm. Nhưng mà
in 2016, the foundation decided to set up Alina Vision.
2 tables in each room.
2 operating theaters.
Yeah. 2 years later, we got the approval to become a hospital. It means that we can provide the full service, including surgery. The cataract surgery is actually quite simple and quick and very safe. We will use ultrasound to remove the cloudy lens in the patient's eyes, and then we will implant the intraocular lens to have the patient see again.
Hôm nay sáng ngày mở băng, tôi cảm thấy rất là hạnh phúc, rất là sung sướng vì mình thấy mắt mình có vẻ sáng ra.
We want to create the accessible and affordable eye care. I'm very happy to see the work from the foundation support to improve the eye care service in my country.
30 years ago, the eye care infrastructure in Vietnam is very poor. The foundation came in, they train cataract surgeon, they bring in more equipment and monitor our outcomes.
The idea of training people to train others is very important.
One of my surgical teachers used to say, if we don't train other surgeons, then who will do our cataract surgery later? Over the course of my career, I have trained 3 surgeons. It feels really great to give back.
Không có mắt được sáng như thế này là tinh tường là sướng rồi, phấn khởi rồi, không phải mong muốn gì nữa. Trông thấy các con các cháu là phấn khởi lắm, coi như là mắt của bà sáng lên thì coi như là tinh thần của bà rất là phấn khởi.
So actually, months before Professor Fred Hollows passed away, he actually insisted on traveling to one more country to train young ophthalmologists and pass on the skills that will help a country to usher in a better eye health infrastructure. And that country was Vietnam. And his trip actually left an indelible mark on the country's eye health infrastructure. And today we will hear from 4 experts from the Fred Hollows Foundation on eye health care and also on program implementation. And first up is our Vietnam Cluster Director, Dr. Phuc Huynh Tan, who is joining us live in Da Nang. Now, Dr. Phuc is an ophthalmologist himself, and he joined the Fred Hollows Foundation in 2003. He is currently leading our program work in not just Vietnam, but also in Indonesia, the Philippines, and Timor-Leste. And he was recognized in 2014 as an eye health hero by Vision 2020 Australia. Please join me in welcoming Dr. Phuc.
Thank you, Laura. Hello, everyone. I hope you all have a good day today. I'm very pleased to present the journey of 30 years of the foundation in Vietnam. First, I would like to give you some highlights of Vietnam country context. We have the population of 96 million people, and we have the population living in poverty is 4%, according to statistics in 2018. We have 64 provinces, and the health insurance cover more than 90% of population. The eye health problems in Vietnam, compared with the time Professor Hollows came to Vietnam in 1992, there is a much improvement in the eye health situation. However, still, cataract cover about 74% of the cause for blindness of people over 30 years of age. Uncorrected refractive error is on the rise, and it accounts about 10% of the visual impairment of people over 50 years of age, particularly in the children. About 25 to 40% of the children to have the uncorrected refractive error. Only 33 children with refractive error have glasses. But unfortunately, according to the recent survey, only 40% of the glasses are correct. Trachoma is not a health public issue anymore, but still there are lots of work to do in order to reach to the trachoma elimination announcement for the country. So you have seen the video and you have seen the history of the foundation for 30 years. This year, the foundation celebrates 30-year birthday of the organization. Also, the 30-year journey of the foundation in Vietnam. Professor Hollows passed away in 1993 after he organized the first training course in Hanoi for Vietnamese surgeons in late 1992. But the Fred Hollows Foundation established in order to continue his work. You have seen in the video, he say one of the very famous sentence of statement of himself is the teacher first. So by that, the foundation started the training program in Vietnam from 1992 to 1998, and we can train about 332 surgeons in all provinces in Vietnam. And intraocular lens cataract surgery to become a norm in Vietnam. In addition to the training, the foundation provides microscope, instrument, and IOL for the Vietnamese surgeons. I can summarize the foundation phase in Vietnam through the 30 years into the 3 phases. The first one is the training program. In about 1999 and 2002, we are pilot the provincial community eye care program in 2 provinces, that's Phú Yên and Quảng Trị. And then we evaluate the pilot community eye care programs in 2003, and we consider that is a good model to replicate to the other place. And from 2004 to 2015, we can cover about the 25 provinces in Vietnam with the community eye care program. And one of the highlights is that we provide a lot of support in the building the hospital and eye clinics. I can name some like a hospital, provincial hospital of Phú Yên, provincial hospital of Quảng Ngãi, provincial hospital of Quảng Nam, and Huế Eye Hospital, Vĩnh Long Eye Hospital, etc. From 2016 so far, we shift to the advocacy program. We support to develop and endorse eye health policy, guideline, and support to the system at national scale. We pilot some new models, such as the diabetic retinopathy, artificial intelligence pathway. We support for learning and sharing. For example, we are going to support to Phú Yên one program called Phú Yên Learning Hospital. Alina Vision, we came to a new model. Since 2014, the foundation supported establishment Alina hospital chains. We set up the first hospital in Hưng Yên in 2015, and we are going to have a few more in Vietnam and in Bangladesh and in India. The Alina Vision is the model of the for-profit but social enterprise, and we aim to provide a high quality, accessible, sustainable eye care for people on income level. At the moment, we cover about 10 provinces in Vietnam, and we're working with the Ministry of Health and Ministry of Education for the advocacy projects. Our donor is Australian government, USAID, Standard Chartered Bank, some company like Novartis, RTI International, and the Atlantic Philanthropy, and some other generous donors. Currently, we have 6 projects in Vietnam cover variety of the investment. We have school eye health project with the Ministry of Education. We have the DR artificial intelligence pathway. We have trachoma elimination. We hope that by the end of 2023, we will submit to WHO the trachoma dossier, and to get from WHO the approval to announce that there is no trachoma in Vietnam. For your information, our neighboring country like Laos and Cambodia, they already declare the trachoma elimination. We are a little bit behind them. We have to try. Community-based diabetic retinopathy early detection. We have the Hub Insight focus on community raising awareness, support by Novartis, and we have the district eye care program from 2021 to 2024 to pilot a new guideline from Ministry of Health. We currently develop 3 projects: the Phú Yên Eye Learning Hospital, the enhanced quality of the refraction service, and we touch into the new area we call healthy aging. I want to share with you about 4 key achievements. We support to Ministry of Health, and they approve the district eye care guideline under the better quality for eye care in Vietnam. They approve it in the 2019. We support with Ministry of Health and Ministry of Internal Affairs and Ministry of Education. So they approve for the optometric professional code. So now in the public health system, in the eye health, Beside the ophthalmic nurse and ophthalmologist, we have the one position in between called optometrics. We have approved the National Cataract Surgery Quality Protocol, and we also have the integration of the eye care material in the primary school and secondary school. Challenge. We work in ENOC on way easy. We have a lot of challenge. The eye health ENOC in the priority of the government. The bureaucracy from the national partner caused delay in the program implementation. We have many challenges from the external and internal environment. Particularly, that the COVID-19 also delay a lot of the program implementation. And the workforce in Vietnam is still under the needs, but the distribution of doctors in remote areas is not equal to the urban and city place. However, we still see the opportunity and still see some light in the horizon. We have the legal framework from the government with the Vietnam National Strategy for Blindness Prevention for the period of 2016 to 2020 and vision toward 2030. We have the national health insurance cover more than 90% of population and a lot of the reimbursement for the eye service. We have stronger network from the Ministry of Health to the eye care working group and International Embryo Research Center. We have more chance to approach to the other funding resource from USAID, Australian government, institutional donor, private donor, and company. This brings me to the end of my presentation. If you have any question, I'm very happy to answer. Thank you for listening. Thank you.
Thank you very much, Dr. Phuc, for that comprehensive overview. To our audience, both online and on the floor, we will open for questions at the end of the session after all 4 speakers' presentations. And with that, it is my pleasure to introduce Dr. Leela Rajpuri. Dr. Leela is our medical advisor at both the Fred Hollows Foundation and Alina Vision. He is an ophthalmologist and also an oculoplastic surgeon who has conducted more than 70,000 cataract surgeries. Dr. Leela completed his degree in ophthalmology at the Institute of Medicine in Nepal and his fellowship for oculoplasty at the Ludwig Maximilians University in Munich, Germany. He has also earned a master's degree in public health for eye care from the London School of Hygiene and Tropical Medicine. Dr. Leela will be speaking about the ways in which outcomes can be improved for cataract surgeries. As we know, and from Dr. Phuc's presentation, cataract actually accounts for most cases of avoidable blindness worldwide. And however, it can be usually treated by a quick surgery that takes less than half an hour. Despite this, the results can vary majorly from person to person. And for a lot of people worldwide, after having cataract surgery, their eye health actually only improves marginally. And unfortunately, certain countries around the world still do not meet the WHO's benchmark for cataract surgery quality. And Dr. Leela will be sharing with us some lessons learned from both Alina Vision and the Fred Hollows Foundation regarding quality assurance in cataract surgery. So now I will pass the floor to Dr. Leela. Thank you.
Good morning, everyone. I am Dr. Leela Rajpuri, medical advisor from the Fred Hollows Foundation. First of all, I would like to thank the organizer for giving me this opportunity to speak at this prestigious gathering. And I'm going to speak about the quality assurance in cataract surgery in general, how it is done and what are the things that we need to take care of. Talk about our quality work in Alina Eye Hospital, Vietnam, and also some of the initiatives that we have started at the Fred Hollows Foundation. First of all, I would like to mention about quality. As per WHO, it has been defined as the extent to which the healthcare services provided to the individuals and patients' populations improve desired health outcomes. In order to achieve this, healthcare must be safe, effective, timely, efficient, equitable, and people-centered. This image is taken from the World Report on Vision, which mentions the 7 domains of the quality, as I have mentioned before: effectiveness, safety, people-centeredness, timeliness, equity, integration, and efficiency. So when you talk about safe, it's avoiding injuries and providing safe service to the patient. timely means reducing wait and sometimes harmful delays for patient and providers, providing the appropriate level of services based on scientific knowledge is what is termed as effective, and efficient service means avoiding waste, including waste of equipment, supplies, ideas, and energy. Equitable means providing care that does not vary in quality because of personal characteristic, and also it should be patient-centered means providing care that is respectful and responsive to individual patients. The Lancet Commission has also prioritized or emphasized on the improving quality of eye care by delivery of high quality services, emphasizing on more holistic perspective, and also adding the planetary health as a component. And it also recommends to use the quality framework put forward by the WHO. Cataract surgery clinical guidelines or benchmarks. Fred Hollows Foundation has also published or prepared a minimum standard of patient care, safety, and good clinical and surgical practice for patients with cataract. And there are also other documentation that can be used for this standardization or having the quality service delivery, like the cataract surgery protocol and the standard operating procedure manual. In the minimum standard for cataract surgical care and continuous quality improvement, the main focus is on the quality, equitable, and accessible and affordable services, access to cataract surgery through a strong referral system, ensuring patients experience the best possible outcomes for cataract surgery by providing comprehensive preoperative care, biometry, safe theatre standards, and postoperative follow-up and refraction. When we talk about the quality assurance cataract surgery, it is required at all the three phases, like the preoperative, intraoperative, and the postoperative. The aim of preoperative evaluation is to confirm the diagnosis, grading of the cataract, assessing the status of other eye, ruling out the ocular trauma and other comorbidities, calculating the power of the IOL, and also to predict the visual outcome after surgery. In the preoperative stage, as we know, we do the patient evaluation, we have the general health evaluation, preoperative investigations, and also the complete eye examinations. And biometry and IOL is done, and we should always make sure that the biometry is done for all the patients to identify the power of IOL, and we should also fill the electronic or paper form for the outcome monitoring tool. In terms of operative care, we should always make sure that there is adequate OT standard and infection prevention and complete sterilization. Staffing level and correct level of surgeons are assigned, and we should have a complete team. We should mark the eye to ensure that the correct patient chart is there and the correct patient is operated with the correct eye, and also correct IOL power is implanted. And preparation for surgery, usually we have to check for eye infection, pupillary dilatation, and also apply 5% povidone iodine. And skill of surgeons should be taken care so that the adequate surgical skills is in the surgeon to take care of the cataract that is assigned to him or her. It's always mandatory, or we should always try to limit the surgical complications and manage when it occurs. When surgery in one-eyed persons is there, it should be done by the most experienced surgeon, and use of intracameral cephaloxime is very helpful in reducing the incidence of endophthalmitis, and it's always good to have the documentation regarding the surgery and also the complication if there are any. In the postoperative stage, we should examine the patient on the first day and also after 1 week and then 4 to 6 weeks. But when there is some problem like complications or any other problem following surgery, follow-up should be more frequent, and visual examination should be done with pinhole, and also slit examination should be done, and IOP is recorded whenever required. Post-op endophthalmitis, if there are any sign or if we suspect to be a case of of endophthalmitis, it should be evaluated thoroughly and treated properly. And we should always provide the post-operative medications, and also it's good to do the refraction in the follow-up to correct the residual refractive error. Now, talking about the monitoring of surgical outcome, it is essential to create a culture of audit and support resulting in overall improvement and to avoid confrontation and criticism. It will help the surgeon to identify the main causes of poor outcome. When the main causes are known, corrective action can be taken to improve the outcome. Encouraging surgeons to monitor their own results over time will lead to better outcome of cataract surgery. Outcome data should not be used to compare surgeons or centers, because the case selection, the surgical skill, procedural facilities, follow-up criteria, and other factors may be different in different settings, and it definitely affects the outcome. So why it's important to measure surgical quality? As we know quality of cataract surgery and resulting patient satisfaction are the engines that drive our sustainable cataract services. We must be able to measure quality before we can improve quality. And it's a globally accepted minimum standard of care, and we should have the follow the WHO benchmark for surgical quality, where it says 80% uncorrected visual acuity of more than 6/18 after surgery. And regular monitoring, reporting, and continuous quality improvement will help this process in order to enhance the surgeon skill, patient outcomes, and also the hospital performance, and ultimately the sustainable cataract services. Cataract surgical outcome monitoring, there may be various or numerous data that may be available, but we should at least record the preoperative visual acuity, postoperative conditions like preoperative conditions likely to affect the visual outcome like comorbidity, types of procedures performed, complications during surgery, postoperative complication, and postoperative corrected and uncorrected visual acuity at the time of discharge, and where possible at follow-up appointments at 3 to 6 weeks and also at 4 to 12 weeks postoperatively. And we should always record the reasons for poor outcome if there are any. So when we talk about the monitoring of cataract surgery, essential ingredients or components should always be the quality standards defining a good outcome. Timely and routine data capture should be there pre and post surgery. Accessible reports. It's important that we not only have the data, but the reports should be accessible that can be utilized in a meaningful way. Feedback is always important to get the interpretation of results and provision of information about potential corrective action. And plan, do, study, act, that is to implement the corrective action. So the outcome monitoring, cataract surgery outcome monitoring definitely helps us in improving our cataract quality services, the surgeon skill, and overall hospital performance. So this is just a sample where it's on that chart, and we can record the data manually and then have the record and analyze it later on for analysis and also improve if there are any gaps we found. And it can also be done in a computerized software. There are several EMR, electronic medical record, available where visual acuity and other data can be recorded, and we can use it for our analysis and for surgical performance analysis. And this is BOOST, which means Better Operative Outcome Software Tool, which the Fred Hollows Foundation and other NGOs have collaborated to develop it. And it's a very simple, easy to use app to measure and improve surgical outcome. It provides the recording of surgical results day after surgery, provides the analysis and benchmark performance against other users, and it also improves the surgical quality where results are poor through tailored changes in the procedure suggested by the app. And it's freely available in Android and Windows app, and it works offline as well. And the more important thing is it's 100% anonymous and is password protected. So BOOST is also one very useful way of doing the cataract surgical outcome monitoring. So this is just a sample showing where the data recording has been done and the first post-op day outcome has been analyzed. Similarly, the visual acuity at the discharge has also been analyzed. So if we get this type of data or result with the good, borderline, and poor outcome, we definitely have the chance to look at it, and wherever there is deficiency or gaps, we can work on to improve any deficiency or gaps. As we know, the cause of poor outcomes, there are 4 main categories: the selection because of the pre-existing disease, surgery because of surgical complication, spectacles because of the uncorrected refractive error post-operatively, and also the sequelae long-term complications like the PCO and RD. And if due to selection, then it's always better to focus on the pre-operative evaluation to reduce the number of patients with other causes of blindness or comorbidity. And if it is due to surgery, we should always work to improve the surgical procedure, including infection control and sterilization methods. If it's due to spectacles, then we should provide the best spectacle correction at an affordable price post-operatively. So monitoring of cataract surgery should be used to improve the visual outcome, increase credibility of cataract surgical services, to create a culture of audit and support, resulting in overall improvement, to facilitate individualized surgeon or centers to monitor their own results over time, to achieve proportion of good, borderline, and poor outcome as per WHO categories of visual acuity, and to identify causes of poor outcome, including selection, surgery, spectacle, and sequelae. So now talking about the cataract quality assurance in Elina Eye Hospital in Vietnam, we have a clinical governance framework which mention about the clinical effectiveness, continuous quality improvement, risk management, education, training, clinical audit, research and development. So all these aspects are taken into consideration whenever we provide the cataract quality services in the hospital. So when we talk about the clinical effectiveness, it's basically the protocols and guidelines that helps to have the proper pre-operative evaluation, the refraction, biometry, and also there are guidelines with relation to the sterilization, OT functioning, cataract surgery guidelines, subspecialty guidelines. So these all helps to provide the right care at right time, right place, and right information. There is facility of documenting all the surgical cases. So we have the photos and surgical video recording. Every cataract surgery is recorded, and we also take the entry segment photos of the pre and post-op examinations. And clinical audit is done in the hospital. Weekly meeting is done by medical writer and senior staffs. We do monthly quality assurance meeting every month to monitor and discuss quality indicators, detailed case review, and biannually and annually as well. So this is a chart showing the surgical visual outcome of cataract surgery over a period of 2 years. And this shows that we do record the visual acuity of all the patients and keep track of our output. And then we discuss if there are any areas of improvement we can do. We also have this total surgical volume recorded in the data. Similarly, the data is also created as per the types of surgery, like the phaco, pterygium, lead surgery, or other surgeries. We also have the report on surgical outcome with or without comorbidity. This also helps us to gauge on the areas of pre-operative evaluation. If there are more comorbidity, we can improve on that. And we also record the complications and see if there are complications arising or it's decreasing in number. And we talked about the quality assurance meeting, and we usually have all the action points and also the action to be done, and responsibility is assigned to particular persons. And we follow up all the actions point. In the quality assurance meeting, we do a presentation outlining all the data that I talked before, like the complications, the number of surgeries, visual outcome. We also discuss about the surgical complications through case presentation, surgical video review, and also medical advisor provides the opinion regarding any complications or if there are anything to be done. So this is the example showing the detail of the patient which we record and the complications that we discussed during the quality assurance meeting. This is another example of post-op 1 week examination which we record and document and take the picture of all the patients. And we also have the system of patient feedback system. It is done at almost all the steps, like through a counselor, and we collect it online, and we have the online software for collecting the feedback and analyzing it as well. So this is sample showing our patient satisfaction score. In one of the month it was 85.14, and it's constantly above 90. The other aspects that Elina Eye Hospital does is the education training, and I think it is also one of the very important component to improve the skill and also ultimately the quality of the eye care services that we provide. Talking about the Fred Hollows Foundation quality priority, it is one of our priority, and we have been focusing and exploring more and more opportunity to improve the quality of cataract surgery in a broader sense. So this is the framework quality work that we have done, developing of the framework and guidelines, tools, minimum standard assessment tools, projects like the CATQUIP, which I'll be talking later, mentor-mentee network. We have developed the cataract quality improvement framework, which provides an overview of how quality improvement will be achieved, and it focuses on mainly 4 domains, that is clinical quality, productivity, cost efficiency, and environmental sustainability. The objective of CATQUIP is to increase the clinical quality, increase the productivity, improve the cost efficiency, and also improve the sustainability, environmental sustainability. So cataract quality improvement intensive project is one of the projects that we have been undertaking at the moment, which is developed through the collaboration of LV Prasad Eye Hospital and the Aurobindo Eye Hospital, and also IHI, Healthcare Institute for Healthcare Improvement. So the key objective is to improve the clinical quality, cataract surgical coverage, decrease the carbon footprint, and improve the cost efficiency, and also improve the continuous quality culture and also leadership for the quality improvement. So we had 3 partners: Homa Bay Hospital, Kenya, Zimmer University Hospital, Ethiopia, and also BNSB Hospital in Bangladesh. So we undertook these partners for the piloting of the SCAT-QUIP, and what we found was that in Jimma University, when we started this project, there was no CSOM practice at all, but at the end of the project, they had this 100% CSOM data collection, and they were regularly monitoring their outcome. When talking about the Homa Bay Hospital, their target was to improve the visual outcome, good visual outcome from 56 to 78% at the end of the project, and they reached 73% at the end of the project, which we can see in the graph. In BNSP Bangladesh, they had this target of achieving 90% good visual outcome as per WHO's new standard of 6/12. And at the start of project, they had the 85%, but at the end, they achieved 89%. Similarly, they also had this project on the reducing of the surgically induced astigmatism. And initially, when we started, the baseline was more than 2 spherical diopter was in 5%, and less than one spherical diopter was in 84%. But at the end of the project, they improved to 92%, and also the reduction in more than 2 spherical diopter was 3% only. So in the end, what I would like to tell is quality of cataract surgery is very important, and it is not only related to the visual outcome, but also related to other aspects of the service we provide. And it should always be a holistic approach for the quality of improvement of quality of cataract surgery. And it is also very important to have developed the culture of quality in the hospital among the team, and the leadership should always be motivated and committed to improving the quality of cataract surgery so that we can improve the patient quality of life and also improve overall quality of cataract service delivery that we provide. Thank you for your attention, and it was very nice presenting this quality assurance in cataract surgery in front of you all. And thank you once again for providing the opportunity to present in this prestigious forum. Thank you very much.
Thank you, Dr. Leela, for your insights on the importance of continuous improvement through monitoring, follow-up care, cultivating a culture of quality and training. And I'm sure there will be lots of questions for your segment at the end of today's session. Our next talk focuses on uncorrected refractive error, a global health problem causing visual impairment to more than 671 million people worldwide. Now, this number is expected to multiply in coming years, especially in the Asian region, with some countries expected to have a prevalence rate as high as 65%. Dr. May Ho will talk about this growing problem in the region and the approaches we are taking with our partners to address this. Dr. May Ho is an optometry and primary eye care advisor at the Fred Hollows Foundation, an optometrist working in public health for more than 30 years. Dr. May's work has spanned continents, and she has helped develop and implemented sustainable eye care programs in Vietnam, Cambodia, China, Sri Lanka, Haiti, Papua New Guinea, South Africa, and Moldova, just to name a few. Dr. May Ho currently serves on the World Council of Optometry Public Health Subcommittee, Optometry Victoria South Australia Education Advisory Committee, and serves on the IAPB's working groups for school eye health and low vision. Dr. May, welcome.
Good morning, and xin chào, ladies and gentlemen, and thank you to the organizers for the opportunity to speak on addressing uncorrected refractive errors in the region. Now, we all know that the main cause of vision impairment globally is uncorrected refractive error, which accounts for nearly half of the distance blindness and vision impairment. This is equivalent to 161 million people. Now, another 510 million people have near vision impairment due to uncorrected presbyopia. So this is equivalent to 671 million people with vision impairment due to uncorrected refractive error. Now, we know that refractive errors can be corrected simply by a pair of glasses or contact lenses or refractive errors or refractive surgery where available. But the reality is, around the world, human resources are often not available to deliver this care, and neither are affordable correction options. Now, if we look at this map here, it's a map of that the global burden of disease uses to mark out their regions of East Asia, South Asia, and Southeast Asia, to which I will refer in the following slide. Now, the crude prevalence of vision loss due to uncorrected refractive errors in 2020 was found to be 4.54% globally. In East Asia, moderate and severe vision impairment, which is visual acuities of between 618 to 3/60, was 3.91% due to uncorrected refractive error, with Southeast Asia at 3.27% and South Asia at a whopping 10%. The main cause of distance vision loss due to uncorrected refractive error is myopia. In 2016, a paper published by Brian Holden posthumously on the temporal trends of the prevalence of myopia, with myopia being defined as less than minus 0.5 and high myopia at minus 5 diopters. Data from their modeling shows that in 2020, myopia affected about 34% of the population, and with approximately, this will increase to about 50% in 2050. And for high myopia, the number was found to be 5.2% in 2020 and is projected to almost double to 9.8% in 2050. So you can see the numbers for Southeast Asia, East Asia, and South Asia. So we can see that Southeast Asia, where Vietnam is located, is at 46% in 2020, and this will increase to 62% in 2050. And with East Asia increasing to 65.3%. So that's quite a lot of people with myopia in the Asian region. So why do we care about myopia and high myopia? Because with myopia and high myopia, there are significant increases in the risk of conditions such as myopic macular degeneration, glaucoma, cataracts, and retinal detachment. These are all conditions that can contribute to the burden of blindness and vision impairment. But on top of leading to permanent vision loss conditions, not correcting myopia also has immediate issues and consequences on people's ability to work and study. In the last 2 years, the COVID pandemic may also have accelerated the numbers with myopia due to lockdowns and learning from home. Now, I'll talk a little bit about how the foundation approaches addressing uncorrected refractive errors. First, we gather evidence of the need for refractive error services. Then we look to strengthen the human resources for delivery of refractive services. We build integrated sustainable systems for delivering affordable and quality comprehensive refractive error services. We also seek to increase awareness and demand for the services. We work with government on policy to support refractive error services, in particular with ministries of health and education. I'll talk about some examples of our work in Vietnam and Cambodia to illustrate our approach. So I'll talk first about the Child Eye Health program that we have in Vietnam. So the Vietnam Child Eye Care Project has the aim to support the integration of health and education sectors to improve the eye health of school children through development and adoption of national school eye screening guidelines, supported by design of tools and delivery of training in target provinces. So this project was piloted in 3 provinces of Hai Duong, Da Nang, and Tiên Giang. Part of it also included research for improvement and to inform decision-making for national adoption of the school eye health policies and guidelines. Now, the outcomes of this project was that we found that 25% of the students that were screened had refractive errors, 48% of them living in urban areas and 13% in rural areas. And 28% of lower secondary school children had uncorrected refractive error compared to 23% in primary school. Staff from private optical shops were trained in refraction as part of this project to ensure that the children who were referred to them would get good quality glasses. 38 district preventive health staff were trained on eye care, training of trainers, and communication skills. The preventive health staff then went on to train 11,000 school nurses, teachers, and youth union staff in primary eye care, school screening, and eye health education, which meant that nearly 250,000 students in the project area had better access to eye care in school health settings. Now, additionally, the project provided vision screening for nearly 941,000 students, and over 30,000 pairs of glasses were provided to the students. basic information on eye care was accessed nearly 2 million times by students and their parents. This project ran from 2016 to 2019, and we had some learnings from it. We found that the accuracy of teacher vision screening decreased over time. So what this means is that regular refresher training needs to be provided for teachers to perform school screenings. The eye health knowledge increased in students, parents, and teachers, particularly in refractive errors and its prevention as part of the health promotion program. The factors which affected students' knowledge in eye health were the age of the students, the parents' level of education, and the level of income of the family. The school eye health projects had a positive impact on students' and parents' knowledge of refractive error, but the impact on their attitude and practices were less detectable. Alongside Vietnam Child Eye Care Project, there was also another project called Better Eyes for Better Education, which is a collaboration with the Ministry of Education and Training and the Ministry of Health to develop eye care training curriculum, teaching modules, and education materials for primary and secondary school teachers. So eye health education curriculum is pictured here. You can see the curriculum for primary and secondary school teachers and the books that were used for the children. These were successfully piloted in 3 provinces, and we advocated for national application in all primary and secondary schools, which are grades 1 to 9. The school eye health curriculum was approved in April 2020 and will be rolled out nationally in the school year this year, in 2022. This delay was due to the pandemic. In Cambodia, we looked at a project where we scaled up refractive error services. We used the same approach of generating national evidence by conducting a prevalence study on the eye conditions and refractive errors in schools, the effectiveness of services being delivered, and barriers to accessing the services. And we will use this information to refine the school eye health model. We also looked at scaling up the National School Eye Health Program, and this program is very similar to what was done in Vietnam, where we seek to develop the school eye health curriculum, which will be integrated with the health curriculum with the Ministry of Education for children from grades 1 to 12. And a training of trainers program will be conducted for teachers to deliver the school eye health curriculum and also to provide vision screenings. To scale up the quality of refraction services, we trained 7 refraction trainers who in turn trained 20 refractionists. 24 eye nurses were also trained as part of this project. The project will upgrade and establish 24 vision centers, and it is expected that the refractionists and the eye nurses will return to these vision centers and provide eye care services there. We seek to improve the sustainability and affordability of eyeglasses in this project by trialing performance-based approaches and to promote sustainable cost recovery models at the vision centers. We will also conduct research into eye health seeking behavior to understand the demand of patients attending the vision centers, which are in the public sector, and optical shops, which are in the private sector, why they chose a particular service, what their out-of-pocket costs were, their satisfaction with the service, and the eyeglasses that they receive. We will also work with government partners to determine the suitability of including prescription glasses in the Government Health Equity Fund for the Poor and social insurance. We also seek to develop partnerships with the private sector for the provision of glasses, so trying to leverage public-private partnerships for ongoing sustainable service provision. In conclusion, the Foundation has successfully implemented projects to address the unmet need for refractive error services in the region and in the countries where we work. We continue to refine the models for delivery and scaling up of comprehensive refractive error services to help eliminate avoidable blindness due to uncorrected refractive error.
Thank you, Dr. May. As one of the many people, I think, in the audience who also suffers from refractive error, your presentation, I think, reached a lot of us with your message. You know, Professor Fred Hollows was someone who completely believed and was an advocate in innovation and trying to find new solutions for age-old problems. And during a period where intraocular lenses was not widely accepted by the medical community, Professor Fred Hollows defied conventions and established 2 IOL factories in Eritrea and in Nepal. That meant that the cost of IOLs could be reduced, meaning that lower and middle income countries had better access to cataract surgery care. And fast forward to the present, and we now have more tools and technologies than ever that could potentially improve the quality of eye health services. For our final presentation, Dr. Sarati Dodson, Director of Research at the Fred Hollows Foundation, will talk about the role of research and innovation in improving our eye health projects and programs. She will share our experiences in using telehealth and artificial intelligence to address diabetic retinopathy in Vietnam's more remote communities. Dr. Sarati Dodson is based in Melbourne in Australia, and she's a health services researcher and behavioral scientist with a particular interest in WASH approach for trachoma elimination, in citizen participation in healthcare, and in health behaviors affecting across different settings and cultures. Now let's hear from Dr. Sarati Dodson.
Hello, I'm Dr. Sarati Dodson. I'm the Research Director at the Fred Hollows Foundation and a public health researcher. I'm delighted to be here with you today to speak with you briefly about the role of research and innovation in improving eye care. Today, there are still 36 million people who are blind and more than 1 billion people who live with some form of vision impairment. The challenge of ending avoidable blindness and vision impairment is huge and growing. As the world's population ages and grows, the need for eye care grows. Despite all the work that has been done to eliminate avoidable blindness, we know that if we don't scale up our efforts, blindness will triple by 2050. Business as usual will not see us meet the challenge. We must discover and take to scale new ways to reach more people with high quality eye care. New tools and technologies will be part of the solution, but technology alone won't solve it. The real breakthroughs will involve new business models, new collaborations, and more efficient models of care. The Fred Hollows Foundation's Research and Innovation for Impact strategy outlines our research and innovation objectives and the approaches we will take to achieve them over the coming 5 years. Our research and innovation work is grounded in our extensive experience supporting the strengthening of eye care practice and policy. We understand the nature and complexity of the challenges faced by healthcare organisations in low resource settings and seek to work with them, healthcare consumers and other partners to identify, test, scale up and showcase innovative solutions. We are uniquely placed to undertake real-world applied research that catalyses meaningful change in the way that eye care is delivered to those that most need it. We have 5 key objectives for our research and innovation work. We want to discover, design and test new and better ways to deliver high-quality cataract care in low-resource settings, to address trachoma endgame challenges, to deliver high-quality refractive error care in low-resource settings, and to deliver affordable diabetic retinopathy care in low-resource settings, and to contribute to global data on the prevalence and causes of blindness and the responses and services needed to address it. Now, I wanted to tell you a little about our work in supporting the uptake of artificial intelligence technology in eye care, and in particular AI-enabled DR screening and its uptake in Vietnam. Innovation is about change to systems, and change to the way people act and interact. Technology can solve big problems, but only when adopted at scale. The Fred Hollows Foundation is interested in finding better ways to tackle the technology uptake challenge. In Vietnam, we are working on the question of how AI technology can be used to reduce the risk of sight loss for people with diabetes. Some of the advantages of a well-functioning AI-enabled DR screening system is that they can be done with non-experts and it just requires a good photo. It's more accessible, it can be immediate, it reduces the workload for ophthalmologists, and it can reduce the costs to patients. We are working together with our partners to find ways that this technology can make eye care cheaper and more accessible. Through the introduction of AI solutions, we expect to increase access to DR screening for people with diabetes and reduce the burden on the country's limited ophthalmology workforce. Several high-quality AI solutions for DR screening have emerged over the last several years. The key challenge now is learning how to effectively integrate these solutions within healthcare systems. Our work in Vietnam will support the uptake of AI solutions for DR screening in this context, but also generate evidence that informs how to approach the challenge of telehealth integration in other areas of healthcare and in other low and middle income country settings. Thank you for listening.
Thank you, Dr. Sarati. Now, according to the WHO's World Report on Vision, at least 2.2 billion people worldwide suffer from some form of vision impairment, and this number will increase to almost half the global population by 2050. However, this trend can be reversed. As I hope that we've shared in this morning's session, collaboration between private sector, between the government, and between NGOs like the Fred Hollows Foundation is key in tackling this issue of avoidable blindness from a multi-pronged approach. Now, we are running out of time, so I think we can take just one question. We do have a question that came up in the chat box for the online audience, and I hope Dr. Phuc, you would be willing to answer this. The question is whether the eye health materials that were shared during Dr. May Ho's presentation would be available and shared and disseminated beyond the project.
Hello. Okay, thank you, Laura, and thank you for the audience raising the question. I can confirm that this material can be shared widely. That's either eye care education material for the primary and secondary school, and that already approved by Ministry of Education and Training of Vietnam, and even it digitalized and uploaded on the website of the Ministry of Education. So it can be downloaded and used by every people. But just noting that that's in Vietnamese. We don't have the English version yet. Thank you.
Thank you very much, Dr. Phuc. And that concludes our session for today. Thank you very much for our speakers. And also thank you very much to our organizers, Media Mice. Let's not lose sight of our vision, which is a world without visual impairment. Have a fantastic rest of the day, and thank you very much for your attention. Dr. Phuc will be around for the rest of the day to answer any questions that you might have to follow up with. And if anyone would be interested also in finding out more about collaborative opportunities for partnerships, please contact Dr. Phuc or myself. Thank you very much. Have a great day.